The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Leslie McGee with the Adult Protective Services Technical Assistance Resource Center. Welcome to today's presentation, Things to Consider in Creating an Effective Online Reporting System. Today's webinar is being presented by Mary McGurran, Margie Aranda, and Donae Sturdivant from the Minnesota Department of Human Services and Andy Capehart from the APS TARC. Before we get started, I want to address a few housekeeping items. NAMERS and the APS TARC are a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services. The models and information provided during this webinar do not serve as official guidance to comply with any part of the APS final rule. All information provided is done so for information purposes only. This webinar is being hosted by the APS TARC. We work with states to enhance the effectiveness of APS programs by supporting our partners' use of data and analytics, applying research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing APS programs with individualized technical assistance. We're here to help APS programs in any way that we can. Just reach out to us using the contact information that will be displayed at the end of the webinar. Please use your computer speakers to access audio for this webinar and make sure the speaker volume is adjusted to your desired level. If you experience audio problems due to internet connection speeds or hardware issues, we recommend exiting the webinar and re-entering. Everyone is muted for this webinar. You may ask questions of our presenters at any time by typing them into the questions box. We will relay as many as we can to the speakers when we pause for question, which for today's presentation will be at the end of the webinar. All attendees will receive an automatically generated email approximately 24 hours after the webinar ends with a link to the certificate of attendance. This webinar is being recorded, and all registrants will receive an email when the recording is made available on the APS TARC YouTube channel. A copy of the slide presentation is available in the handouts section of your control panel and may be downloaded at any time during this presentation. Now we are going to run a quick poll so we can get a feel for the makeup of our audience. I'm going to launch the poll now, and you may vote by clicking directly on your screen to select the profession you most identify with. I'm going to leave it open for about 30 seconds to allow people some time to respond. Okay, we're getting a couple of people clicking on their screens, and I'm going to leave it open for just a little bit longer to give people as much time as possible to respond. Okay, it looks like we have about what we're going to get, so I'm going to show our responses, and it looks as though we have the majority of our audience as adult protective services professionals. I'm really interested to know who the 11% other are, though, so if you'd be willing to put that in the questions box, that would be great. Thank you. Okay, as noted earlier, we have several presenters today from both the Minnesota Department of Human Services and the APS TARC. So at this time, I'm going to turn it over to our first presenter, Andy.
Thank you so much, Leslie. And if we could advance a couple of slides, I believe. Thanks, Leslie, and hi, everybody. Thanks for being with us today. We appreciate you being here. So if you're not aware, the Administration for Community Living has published the final regulations for adult protective services programs. You see a link here at the bottom of this slide, and you can download the slides whenever you like. So you can access those regulations if you haven't looked at them yet. I put a quote from that final rule on the screen that pertains to today's topic. I don't usually read slides, but I'm going to read this one. The state entity shall establish standardized policies and procedures for receiving reports of adult maltreatment and self-neglect 24 hours per day, 7 calendar days per week, using multiple methods of reporting, including at least one online method to ensure accessibility. And so As we stated earlier in our disclaimer today, today's presentation isn't meant to be guidance for coming into compliance with the final rule, but it could start the conversation in your state about online reporting if you don't have it already. And we wanted to include this quote from the final rule today just to give some context for one of the reasons why we chose to present this topic. So next slide. Here's a little bit of data from our recently published National Process Evaluation of Adult Protective Services. This chart shows how states responded to our practice survey that we administered a few years ago when the states were asked about online reporting. You can see there's a tiny portion here that have county-specific online reporting, but the rest of the states are pretty much evenly split among having and not having an online reporting form. So this is one of those areas where states are going to be working on to get in compliance with the final rule. If you haven't checked out the report where this comes from, I highly recommend that you take a look at it. The link is at the bottom of this slide as well, which is in your handouts if you want to check it out. It's a wealth of information, multi-year project that we worked on that we're very proud of. So if you haven't looked at it, we recommend you take a look at it. Next slide. So a few benefits of online intake, if it's something you don't already have in your area. All of this will likely be articulated by our colleagues in Minnesota today, and probably better than I am articulating it, but just setting the stage a little bit. Some of the benefits allows you to accept reports 24 hours a day if you don't already have online reporting or you don't already accept reports 24/7. Allows folks who work nights or after hours to make reports firsthand. I think any of us who've worked in APS are familiar with the scenario of an ER social worker who sees a client at 3 o'clock in the morning, has to pass the baton, pass the report on to the day social worker to make the report, and the day social worker just doesn't have the information you need to process the report. This can help ameliorate that just a little bit. It can also decrease the number of calls to your telephone intake line when folks go to the form instead of calling the intake line. Next slide. Some challenges involved with online intake: make sure you have a process for importing the data. I worked for a county adult protective services office in Ohio, and we started a county form many years ago. And then we put everything in place and it gathered great information. And then we realized when it was time that we would have to cut and paste all the information into our data system. There might be some people who are horrified by that idea on this webinar right now, and I cannot make you feel better about it. It was kind of an awful process, so lesson learned there. Make sure you have clear policies and procedures so that everyone understands their roles, what the timelines are for reviewing and assigning cases. You'll likely not want to take emergencies via the form, or maybe you do, but if you don't, they can slip through the cracks. So consider what you'll do if that happens. You may get insufficient information from reporters. I've seen online reports that have 2-word responses to requests for information. So maybe that's something Minnesota has seen also that they'll share with us a little bit later. Next slide. Some other issues for your consideration: make sure to engage folks in the community and your staff when you are designing your online intake system. This helps with buy-in. And I found that sometimes caseworkers think of things that supervisors and managers and administrators wouldn't think of in a million years. They can be very helpful. If you've purchased a data system kind of off the shelf for APS, there may already be something you can add on to the system for online intake. There's a lot of these off-the-shelf systems that have some sort of component like that, so you might want to talk to your vendor before you get too far down the line. You may also want to consider a disclaimer of some sort up front that asks for reporters to agree to terms before they make a report. Make sure they understand there's no emergencies and the ins and outs of reporting. And then consider the amount of information that you ask for. You can sometimes ask for too much information. You could ask for too little. Maybe you want to mimic exactly what you collect when you're on the phone lines, but you want to give some consideration to that. If you have lay people that are using your form, they may not be very computer savvy or tech savvy, so you might want to think about that too as well when you're designing what questions to ask. And next slide. This is just a shameless plug for a brief that the APS TARC published called Intake: The Gateway into APS. The brilliant Jennifer Kirchen with our staff wrote this, and we were very proud of this brief. So I've included a link here as well in the handouts that you can, slides that you can download if you would like to check it out. It doesn't specifically pertain to online reporting, but I think there's some information in there on that. And it's just a good brief on intake in general. So Next slide. Went through my slides pretty quickly so we can get to the stars of the show, the folks from Minnesota Department of Human Services. And I think at this point I will turn things over to Mary McGurran, my colleague who I respect very much. I'm so glad she's with us today.
Thank you, Andy and Leslie, for inviting us to be here today. Margie Aranda is our operations manager. She'll be speaking after my portion is completed, and after Margie, Donae, our contract manager, will be speaking. And we're really happy to be here today to talk with you about our online reporting system and sharing some of the challenges that we've experienced and some of the things that we've learned, and hoping that that will help other states as well. Next slide. So we broke this down into 4 different sections. We're going to talk first about the policy of the reporting system and the budget. Then Margie's going to talk about technology and systems, and Donae's going to talk about the operations of the online reporting, and then we'll share some discussion about lessons learned. Next slide. So policy and budget. Next slide. So our APS operational plan that we developed, as I'm sure other states did during COVID, includes the importance of identification and reporting for adults who are vulnerable and suspected of experiencing abuse, neglect, or financial exploitation. Our reporting system is so critical that it's part of our mission, and all of our stakeholders were involved, or many of our stakeholders were involved in developing this mission. So there's broad consensus across our stakeholders that the reporting system is really critical. And our mission statement means that our online reporting system has to be easy to access, easy to use, intuitive for reporters, accessible, and not pose barriers to reporting, because it is our state policy to encourage reporting. Our mission, values, principles, and goals that are outlined in our operational plan are integral to our APS system, and to ensure that we are able to identify adults who may be vulnerable and in need of adult protective services, and that those adults are reported to our reporting system and referred for a timely response by APS. And next slide. So adult protection in Minnesota, foundationally, it's important to understand that while our reporting system is fully state administered, our adult protective services are administered by our state's 87 counties, and 9 of the federally recognized tribal nations in Minnesota have adult protection programs. This means that in Minnesota, we're operating the reporting system through the state, but that the authority to make decisions about adult protective services, acceptance, intake decisions, are by our county administered system or by tribal nations who are managing their own programs. APS in Minnesota is required by statute to use standard decision tools in making their intake decisions for response to reports. But that authority is with our county programs and does not lie with the state. We set the policy for intake, we establish the tools, and then counties make the final intake decisions. Next slide. So in 2015, Minnesota moved to the state centralized reporting system, which was operated by the Department of Human Services. And we are the same agency who oversees and supports our county adult protection programs. Our state centralized system is called the Minnesota Adult Abuse Reporting Center, or MAARC. Under the statute, it's referred to as the Common Entry Point. And our Common Entry Point, or MAARC, moved from a system that was based in a county-based reporting system. Counties took those reports usually during the day, and they had law enforcement as their after-hours delegate to accept those maltreatment reports. The Vulnerable Adult Act in 2012 changed to give that authority to the state, and in 2015 we implemented the Minnesota Adult Abuse Reporting Center centralized system. So reports in Minnesota are not made directly to APS, they're made directly to MAARC. MAARC is the door to adult protective services, and all of those reports are entered into our data system, and we track critical steps in response to those reports for the adult who's referred. Our state law requires that our reporting door has to be open 24/7, 365, and very importantly, that our reporting form must be standard. So our online form is the same form that we're using for the phone reports. They may not look the same, but the data fields are the exact same. Next slide. So reporting and compliance under our vulnerable adult statute, which carries all of the setup for our online reporting policy, is clear that reporters are that are not calling about maltreatment must be referred, and so that's fairly easy to handle on the report side when the person's making the report by phone. But when it's by online, we have to think about other considerations, which is one of the reasons why our reporting system is at this time restricted to mandated reporters. And we are in the middle of a project to open it up for everyone. But that referral system for people not calling about maltreatment is very important. We do not require reporters to complete every field in the report form under statute. We have authority to take those reports and refer them to APS or the state agency that's responsible for response, even if every field in that form is not completed. Also at the MAARC, all incidents that may be criminal are referred to law enforcement. This task is through the reporting system, including the online system. It's not left to APS intake decision. And most critically, for the data analysis and program management, all reports, whether they're phone or online, are entered into a common centralized database. Next slide. So additional requirements that establish our policy are that MAARC makes required referrals to the agencies responsible for response. So as I said earlier, the state is not the administrator of the adult protection programs. Those services are administered by our counties unless a licensed provider is alleged responsible, and then those reports go to the state agency that is licensing the provider. Because there are 87 counties with 77 adult protection programs in Minnesota, it's critical that MAARC has authority to determine the county agency responsible for adult protective services to avoid conflicts when the adult may be temporarily located in a county different than their county of residence, for instance, in a hospital or at a family or at a short-term service provider, when the incident may have occurred in a county different than where the person is currently located. So that authority under our policy belongs to the state, and that is also part of the APS rule. It's one of the new requirements, and we've got that in place as part of our policy in state statute. The only assessment made by MAARC is that if there's an immediate need for adult protective services, that's assessed at MAARC, and that is then referred to the county for immediate response within 24 hours if there's an identified need based on assessment with the reporter to safeguard the adult's life or health, or if the adult is likely to experience a loss of health or function within 72 hours, or because the adult has experienced a sexual assault and has not had a sexual assault examination or medical care. And we use the same assessment online that we do for the phone reports. Next slide. Also very important is the policy around our data classification. In Minnesota, the report data is confidential at the MAARC, whether it's the phone or the online report, meaning that once that report is submitted, the report is available only to the department, and the agency is required to receive the response. It's not available to the person or any person identified in the report. Any data that would go to people other than those identified under statute as referrals for MAARC would be under the authority of the lead investigative agency or APS. Also, under statute, the data is required to be available to the Department of Human Services to be used as a resource to track critical steps in response to the person, so that we know what's happening to adults that are reported and referred to adult protective services, and for program management and analysis to identify effective remediation to stop, reduce risk, and prevent maltreatment reoccurrence. Next slide. So essentially, MAARC accepts the online reports and refers them or passes them to Adult Protective Services, who's responsible to make decisions on the response to the adult who was reported as vulnerable and maltreated. The fields in our online report, because we have only one form, all the fields are the same, the online report corresponds to the state's standard decision tools for adult protective services intake. And part of our state law also is that APS at the counties are required to use the standard intake tool in making decisions. So all of the fields in the report form line up with the criteria in the APS intake tool, as well as the definitions, in order to create coherence between the online reporting system and APS intake decisions for adults who are referred to by MAARC to a county for adult protective services. Next slide. So adequate resources are a critical consideration in a successful online reporting system. When we did the change from the decentralized county-based reporting to state centralized reporting, we had a combination policy bill, which we talked about some of the policy, as well as a budget bill, because we knew that this would be a budget item for the state. Because our online and phone reporting systems operate concurrently, use the state's same technology, and the same state staff make the referrals for both the phone and online reporting, it's challenging to separate out the costs. This slide identifies some of the types of persons and expenses that an online reporting system would have. And Donae is going to share data in a little bit in the presentation that gives some sense of the proportion of phone and online reports to help separate out how these costs may incur. But we also know that when the mandated reporter enters their own information, it's a fraction of the cost to having our call center or report center enter that data into the state centralized data system. So at this point, again, although we're unable to separate out the costs, our total reporting system exceeds $5 million, including the reporting center operations 24/7, the policy support, the technology development and maintenance, the application integrations with adult protective services, other LIAs and law enforcement, our database, data reporting, and 24/7 IT support, a lot of the issues that Margie's going to go over in detail. There are options for federal funding if your system is part of your child welfare information system, as ours is part of our CWIS, or if you're, or through CMS, for if your system is part of your incident reporting system that's required for your HCBS service. And Advancing States did a recent webinar on options for FFP that was very helpful. So now I'm going to turn things over to Margie, who's going to go more in depth on the technology considerations for online reporting.
Okay. Well, thank you, Mary. Well, good afternoon. And I'll be providing the high-level overview of our online reporting system. I'll also be providing some information on options for your team to consider in your design process. And due to time constraints, I won't be going into specifics of our online reporting system, but if you would like more details regarding the system technologies that are part of our reporting process, you can definitely send over your questions for our team to answer. Next slide. Minnesota's reporting system implementation was driven not only by legislative mandate, but also by the need to address challenges faced by reporters. To address those needs, a central point where a person can either call a dedicated phone line or use a web-based form to submit maltreatment reports was created. The Minnesota Adult Abuse Reporting Center is staffed with individuals that are trained to receive reports, review, and refer these reports to the appropriate agencies. In my presentation, I will refer to these staff as agents. Using the online reporting form to take maltreatment reports greatly increased the efficiency of the overall reporting process. One example of this efficiency is the time it takes to process a phone versus a web report. Our current stats show that when someone calls in to make a report via phone, it usually takes 30 to 40 minutes from the time the phone call was received to the time it is referred to the appropriate agency. But with the web form, it only takes about 10 to 15 minutes, as all the pertinent information has been populated by the reporter, facilitating the process for the agent to review and refer the report. This saves time for everyone involved. The online reporting format has also streamlined data collection because of the consistency of the information that is being collected. Data accuracy and integrity have also improved due to the reduction in manual entry errors. Our online reporting system, coupled with access to our internal support portal, enables us to have real-time reporting and analysis. This feature facilitates our team's ability to address technical issues promptly and efficiently. This is a key advantage which enhances our operational responsiveness. Next slide. When creating your online reporting system, the goal should be a system that is not only efficient, but also user-friendly and accessible to all. I'll touch on a few points to consider when beginning your design discussions. Let's start with the user design process. Creating an online reporting system using a user-centered design process means getting feedback from the people who will actually be using the system on a daily basis. This can be done by conducting in-depth interviews, organizing focus groups, or sending out surveys to understand reporter needs and pain points and expectations. The design process is a collaborative effort between the business team, the technical design team, and your users. By involving end users, you ensure that your system aligns with the real-world requirements rather than assumptions. Equally important is the implementation of comprehensive usability testing. This step can occur once your online reporting form is designed or as a part of the ongoing process of designing your form. This process involves having real users try out the form before it's finalized to identify any issues that make improvements. When our team transitioned our web form to a new platform, we didn't just rely on internal opinions. We engaged a select group of call center agents, our frontline users, to test the form extensively. Their insights were invaluable, highlighting issues we hadn't anticipated and suggesting improvements that significantly enhance the user experience. Next, we'll talk about the importance of clear, intuitive interfaces. Our aim is to create a system that users can navigate effortlessly. This includes clear labeling and easy to follow instructions. Remember, you are designing for users of all technical skill levels. On our web form site, we provide a comprehensive online guide with step-by-step instructions for users to assist them in entering information on the web form. This extra step has gone a long way in enhancing user confidence and improving the reporting experience. One of the crucial items in web form usability is the data validation and error handling process within the web form. This is a critical process for maintaining data integrity and user satisfaction. We knew that we needed to implement strong data validation rules to obtain accurate and complete data in our web form. In an online form, clear error messages are essential during the data entry process. Users should know exactly what went wrong and how to fix it. Based on user feedback, we've learned to display error messages immediately, rather than waiting until the reporter is done entering the information in the web form and ready to submit. This small change notably improved our user experience and reduced reporter frustration. Equally important in an online report design is accessibility. Your system should be compatible with various assistive technologies, such as screen readers for reporters with limited vision capabilities. We should commit to continuous improvement based on ongoing user feedback. The ultimate goal is to create a system for online reporting that's truly accessible to all users regardless of their abilities. Next slide. Next, I'll be discussing various methods of data sharing and transmission that we employ in our reporting system. Our system employs an API, Application Programming Interface, for seamless communication between the systems used for ensuring address verification and law enforcement jurisdiction accuracy. During the phone report processing, our API integration with the GIS application, Geographic Information System, verifies the authenticity of entered addresses and determines the correct law enforcement jurisdiction based on the address information entered by the user. Given its success, we plan to incorporate this API into our web form. We also employ encrypted email to securely transmit report copies to county agencies, law enforcement, and medical examiners. We have automated the encrypted email creation process in our system for report distribution to these partners. This allows us to enhance efficiency by eliminating manual email address data entry, thus reducing human errors. For secure file transfers, some options include SFTP, Secure File Transfer Protocol, and FTPS, File Transfer Protocol Secure. Both of these methods provide the ability to securely transfer files between parties. At this time, our online reporting system does not use these methods, but you should be aware that these options are available to transfer data securely. Secure web portals for data access can also be implemented. A web portal is a secure online gateway that allows users to access specific data or services, such as a web form, through a web interface. Role-based access controls should be implemented when using a web portal to ensure users only view data or services that they're authorized to access. Implementing these controls is a measure that will require you to provide some technical support to users. These various methods of data entry and transmission require thorough planning to ensure efficient, secure, and accurate data handling. Next slide. When we talk about data transmissions, we mean how data is shared and moved between systems. Currently, we share report data with our agency partners, law enforcement, and medical examiners, and the Office of Ombudsman. Let's go over some key points to ensure this process is done effectively and securely. Ensuring secure data transmission involves regularly updating your system security certificates, using strong encryption, and monitoring data activity. Training users on proper data access and protection is crucial. Compliance with state-specific data protection standards ensures data safety and legal adherence. It's important to follow these standards to maintain compliance and protect your data. Compliance ensures that you are following the rules and protecting people's information. Next slide. Our web report data is currently stored in an on-premise data warehouse. A data warehouse is a centralized repository designed to store, manage, and analyze large volumes of structured data from multiple sources. It's optimized for query performance and data analysis rather than transaction processing. On-premise storage involves storing data on hardware and servers physically located within an organization's premises, giving you greater control over your data and security measures, both with higher upfront costs and maintenance responsibilities. Cloud storage, on the other hand, involves storing data on remote servers managed by third-party service providers such as AWS, Google Cloud, and Microsoft Azure. Cloud storage offers scalability and cost efficiency with lower initial investment and access from anywhere with an internet connection. However, it does rely on internet access, and you are dependent on the provider's infrastructure. When deciding between on-premise and cloud storage, consider factors such as budget, scalability, control, and regulatory requirements. Cloud options offer flexibility, while on-premise storage provides control. Ensuring strong security measures is crucial for either of these storage solution options. Next slide, please. Next, let's discuss online reporting data storage considerations for your online reporting system. As your organization grows, your data storage must be able to handle increased loads without slowing down. Choose the scalable storage solutions to allow you to easily increase storage limits and maintain high availability. This ensures quick access to data with minimal downtime. Regular backups protect your data by creating duplicate storage safely offsite. In case of hardware failure, human error, or disasters, these backups allow for easier service and data recovery. A continuation of operations plan outlines steps to minimize disruption and quickly restore critical data and services during emergencies. Parts of our COOP plan were implemented during the recent global outage. Our call center team was able to continue receiving maltreatment reports using the backup processes that were outlined in our COOP. Compliance with regulations such as HIPAA is crucial to protect personal information and avoid legal penalties. Anonymizing sensitive data prevents individual identification while allowing you to continue using this data for data analysis, ensuring privacy without compromising usability. Your reporting tools should be flexible, offering real-time access in various formats like dashboards and report summaries. System-agnostic data access ensures compatibility across platforms, enhancing flexibility and ease of use. In the process of designing your online system, discuss the reporting tools that will be incorporated into your system design. By focusing on scalability, backup and recovery, legal compliance, and reporting customization, you can effectively manage and utilize your online reporting system data. Next slide, please. While these systems can greatly enhance our ability to collect, analyze, and share data, there are several hurdles we need to be aware of and address effectively. Integrating with existing systems requires careful planning and possible custom developments to ensure compatibility. Merging your modern online reporting system with a legacy case management system is difficult, but it can be done with careful planning in your design process. Ensuring system reliability and uptime is crucial. Robust infrastructure and good maintenance practices are essential to prevent downtime and data loss. Overcoming user resistance involves clear communication of benefits involving users in the implementation process to gain their buy-in. Providing comprehensive training and ongoing support ensures users feel confident with an updated reporting process. Data security is paramount. Complying with data protection, regulations, and implementing safeguards such as encryption and access controls are necessary to protect sensitive information. Balancing standardized processes with customization allows the system to meet specific user needs while maintaining efficiency. Regular maintenance and updates ensures the system stays current and effective, fixing bugs, adding features, and ensuring compatibility with other systems. Addressing these challenges effectively ensures a successful online reporting experience for your users. Now I'll hand it over to Donae to provide you information on our reporting operations. Next slide.
Good afternoon, and thank you, Margie. My name is Donae, and I am the contract manager for the Minnesota Adult Abuse Reporting Center. I'm generally responsible for monitoring the overall operation of MAARC Call Center and ensuring the reports are accepted and referrals are made timely per state policy. And today I'll just be going over some information in regards to the roles and responsibilities of the Minnesota Adult Abuse Reporting Center, specifically the call centers, as well as just going over the online reporting form and the required referrals, some of the ancillary systems that Margie had mentioned that are used by the call center, as well as some public awareness and marketing tools that we used and the data that Mary had mentioned earlier in her presentation that we've identified with the marketing as well as the number of reports. Next slide. So the Minnesota Adult Abuse Reporting Center is available 24/7 and is the common entry point responsible for accepting reports of suspected maltreatment of adults believed to be vulnerable and referring non-maltreatment related inquiries to the most appropriate resource. MAARC accepts and processes reports received online and by phone and refers the report to the agency responsible to respond. Phone reporting is available for voluntary and mandated reporters to make their report with a live call center agent. However, the MAARC online reporting form was created specifically for mandated reporters. Phone reporting is available, important to note that the reporting methods collected, they collect the same information as Mary had mentioned earlier. And the information collected, again, is supports the initial screening process and is aligned with this APS structured decision-making tool. And next slide. And going over some of the processing times of the call center, the MAARC is contractually required to determine the agency is responsible for receiving the report and refer the report to the agency responsible to respond within 4 hours of receipt. The referrals are made to our lead investigative agencies, and that includes APS, which is our counties, and then our 2 state licensing agencies. The referrals are made by the call center, and again, those referrals are made to the lead investigative agencies within 4 hours. And there's other referrals that may be required in the report, which would be to law enforcement, medical examiner if the vulnerable adult death was a result of the suspected maltreatment, as well as the ombudsman. And those referrals are also made along with the LIA within the 4-hour time frame mentioned. Please note that our statutory requirements require that the reports be referred within 2 working days to the lead investigative agencies and within 24 hours for the emergency protective services, including law enforcement, medical examiner, and ombudsman. On average, the call center is processing and referring those reports within 2 hours, so less than our operational requirements of 4 hours, as well as significantly less than the statutory requirements. The next slide. What we're looking at here is an example of the front screen or the main screen of the adult maltreatment, or excuse me, the MAARC mandated reporter form or online reporting form. On this form here, we have an actual guide. It's this blue link that's at the top. This guide is a guide that assists the reporter with making that report online. As you can imagine, we don't have anyone live, an agent that would be able to assist with making that form or completing the form. So we need to make sure there's some sort of tool or guide available for the mandated reporters to complete that form. The guide itself goes through each section of the report and explains the information that is being captured and what information should be entered in there. We found that that's critical in making sure that the information and the questions are clear and concise, make sure that we're getting the accurate information that the call centers need in order to process and refer those reports. In addition to providing that guide to aid and assist the mandated reporter with completing the form, we found that it's very important, one, that we have some sort of helpful hints on the main screen with any problems or any operational issues that we may experience, or one, just maybe explaining to the reporter how to actually complete the form in regards to going forward and back, making corrections, things of that sort. We found though having those helpful hints there would aid, if any issues, with trying to navigate through the actual form. Again, this form is only for use by mandated reporters, but we also have found that there are some individuals that the general public have been able to access and locate this form. The form is public, so we understand and accept that we may find that the general public may access the report and make reports and not mandated reporters. That does not happen frequently, but it's a consideration that we are aware of because of the report being public. But it does specify specifically it is a mandated reporter form. On this form, on the front page, we did work with our IT partners in making sure that there was a method to posting messages instantly on the fly. In the event that there's any maintenance that is scheduled, we have the ability as business as well as IT to access the administrative side of this form and place a message up on the screen, which would post and display for any mandated reporter that were to access the form and are having any issues. They would be informed that they could then make their report on the phone with an agent if the form was unavailable for maintenance. Also here, we also have in red, you'll notice that some language in regards to the non-maltreatment referrals. Now, our mandated reporter guide does list some of the referral partners that we have, and specifically like child protection. If it's the report or the maltreatment, occurred outside of the state of Minnesota, we do have information available in the guide for those referrals for NAPSA, as well as pop-up messages that are included in the report form based on entries that are entered into the report. So for example, if it's determined that the vulnerable adult or adult that's believed to be vulnerable is under the age of 18 or was under the age of 18 when the maltreatment occurred, a pop-up message would display verifying that information, and then there's a link to the NAPSA webpage that allows them to direct them to that page to determine the appropriate agency to refer that reporter to, or where they should make their reports. In addition, for the non-maltreatment referrals, pointing out here that MAARC is not 911. And so we have a message here to direct callers to make sure, or reporters, to make sure that if they're reporting any type of maltreatment, if there's any emergency or if there's a need for immediate help from law enforcement, 911, that phone call should be made before making the report with MAARC. This information is shared on the phone when an agent is, or excuse me, a MAARC agent is speaking with a reporter, and they refer them to call 911 and then to call back to MAARC to make their report. And then we have the messaging here online on the mandated reporter as well, as well, direct them to make those referrals and to call into 911 to make those referrals to 911 and then come back to make a report with MAARC. And we were actually contacted directly with our law enforcement agencies, and they were really concerned regarding MAARC being a replacement for 911, which MAARC is not. MAARC is not a replacement for 911. So law enforcement obviously had some concerns in regards to not reporters not using 911 anymore and defaulting to the MAARC form to report any emergencies. So we worked with law enforcement to craft that language that we currently have on our web form here, as well as the scripting that is used by the call center agents to ensure that MAARC is not accepting or is not perceived as being 911. And next slide. And the online reporting form, again, captures the same information on the phone reporting form. The information collected in the MAARC online form supports the APS initial screening process and aids MAARC with determining the agency's responsible to receive the report. The form itself collects the who. These would be the people that may be aware or involved in the report. This includes the adult, the reporter, any persons alleged responsible for the suspected maltreatment, and any supporting individuals that may be aware, ancillary people that may be aware of the maltreatment and be able to support that. It also captures demographic information, date of birth, etc. And again, as I mentioned earlier, that date of birth field specifically for the adult is critical in ensuring that the adult is age 18. And so we do have, again, mentioned that there are pop-up messages and those required fields directing them to make that report not with MAARC and finding the appropriate agency to make those reports to. It also captures the what and the how, which is the type of maltreatment that occurred or is believed to be happening, what happened, the impact that the maltreatment may have had on the adult, and action done to protect the adult. Information on the time frames when the maltreatment occurred, and then where the location of the maltreatment occurred, where the adult is located, and the location where the adult died in the event that is applicable. The where for MAARC in the call centers is critical, as these locations are used for making those required referrals that I mentioned earlier. If the information entered into the form or the report is not accurate, that could delay any protections of the vulnerable adult. And so that we want to prevent, and in doing so, we identified some of those ancillary services that Margie had mentioned that kind of aid the call center as well as the form in getting that accurate information and making those correct referrals. As Margie mentioned, some of those ancillary systems aren't currently in the web form, but they are used in the phone form. Next slide. And in regards to the accuracy for those timely referrals, and to ensure that, we use a geo-mapping system, and the map itself is integrated with our phone form report. And what it does is, as you type in the address, it is validating that address against the mapping system that we have partnered with our agencies to get that accurate information from 911. And that information is then used to determine the agency responsible for receiving the report. If law enforcement is required to be notified, the address of that incident location or the physical location of the adult are used to determine the law enforcement agency with jurisdiction. The address of the physical location of the address of the adult, or where the adult is physically located, is also used for determining the lead investigative agency, APS. And if those addresses are incorrect, that could result in incorrect referral, and then the lead investigative agency having to bounce the report back to MAARC to have the report reassigned to the correct agency responsible. Although MAARC is processing those referrals timely, it can still result in a delay. So it's important to ensure that the information that we're gathering up front is accurate. And although we don't have the map incorporated in the web form now, we obviously can see the importance of having that in there so it does not delay or cause an incorrect referral to an incorrect agency. We also have the law enforcement data interchange. This is a system that allows law enforcement to be able to partner with us and receive the reports via a data interchange, where the reports are submitted to them electronically versus a secure email format. We found that this has been very effective and it reduces the time and processing times on the call center side when those reports are received by the call center and referred to those agencies. And lastly, the MAARC operations dashboards. We have a couple dashboards. The operations dashboard is used to monitor the operations of the call centers to ensure that they are processing the reports timely and that they're handling any phone calls, that are received by them during the day, and making sure that those are handled and processed timely within those 4-hour time frames. We also have a business dashboard that is evaluating, the operations dashboard is looking at the phone calls specifically and making sure that those are received and are being processed timely. And then the MAARC business dashboard is monitoring the reports that are received by the MAARC call center. And then those are also looking at those referrals and ensuring that those referrals were done are made within those time frames. Again, the 4 hours for the LIA referrals, law enforcement, and emergency protective services, as well as the ombudsman, are all referred, within the 24-hour time frame. Next slide. This slide is an example of the MnGeo map that is used by the call center. The map itself is an external map or website, that is used. We found that this was the first form or MnGeo map that was used by the call center to determine the correct location or agency responsible for receiving the report. And the map itself is very helpful because we do have some cities that cross over or overlap over multiple boundaries or multiple counties. And so if there was ever a question on an address, trying to determine which county is the correct county associated with that address, you could actually zoom in on those boundaries and verify if this is the correct address or not. And this is something that we're looking to have incorporated within our web form. This would aid the reporter, mandated reporter, with making sure that the address that they're selecting and entering in the report is correct. The MnGeo mapping system allows you to perform a search by the location name. So if it's a professional business, you're able to do a search or perform a search by the name. So if there is a local hospital, they're able to enter that hospital name in there, and it will still give them results if they don't know the actual physical address. In addition to that, there is looking for an address type of head. So when you're typing in the address options would then display and being able to select those, and that's also a way of form for validating that. Again, once the addresses are confirmed as a valid address, those are used to determine the jurisdiction for law enforcement, county contact for the lead investigative agency or emergency protective services, medical examiner, and the the law enforcement the lead investigative agent referrals. And then we have next slide. So here's some of the data that Mary had mentioned earlier that I would be presenting or going over here with you guys. And you can see here that when we first started in 2019, majority of our referrals were received, or reports, received using the phone reporting system. There's approximately 41% of the reports received were by web in 2019. You can see by 2023, we were able to get that increase to 57%, And that was through numerous methods, specifically more of our public awareness campaigns and marketing that we have done in order to promote the web form as well as, or the online form, as well as making modifications to making sure that the form itself is user-friendly and again is more accurate in giving the information that is needed. Next slide. And this chart here represents the number of reports received by APS that were accepted for response. Of the total reports accepted by APS, online reports have a higher percentage. Online reports, we believe, because they're made by mandated reporters who are presumably know when the adult meets the criteria under the VA Vulnerable Adult Act as vulnerable and maltreated. So that is our belief in regards to why a majority of those reports are accepted versus none. Next slide.
Today, I think we had a data error on that slide.
I see that too now. It's flipped around. I apologize.
Yes.
Thank you. And next, this slide here, we're talking about reporter preference. So these are the results in regards to some of the marketing that we've done. When a phone report is made, and if the reporter identifies themselves as a mandated reporter, call center agents ask if they're aware of the online form. And of the responses that we've gotten, you can see here that 77% are aware of the online form. So that would lead us to believe that our marketing is working, but they just really, 33% of them prefer to use the phone. And so no matter what marketing is done, you know, some people just want to use the phone. And a lot of times we find that it just depends on when they're making the report, where they are when they're making the report. If they happen to be in their car, things of that sort, it may not be easy for them to make a report online. Phone might be more usable for them. Next slide. Some of the marking that we did, a majority of this is done by our call center. So this occurs when a caller is calling in and to make a report. They're asking, how did you hear about us? And based on our responses that we received from the call center, overall majority of the reporters heard about us from licensed providers or online, and then through family and friends. That was kind of the third tier in regards to how they've heard about us. And so this information has been useful for us in determining how we can further, you know, market and inform the public in regards to MAARC and how to make those reports. Next slide. Overall lessons learned. I know that we're getting down to the last couple minutes of our presentation. So in general, our ultimate goal really is to increase the accuracy and identifying failure points and preventing delays in the services and supports to the adults. And in doing that, we are continuing to make changes to our online reporting form to ensure that the correct information is collected. And I'll let Mary and Margie add on if there's anything else that we may want to point out specifically here before the end of this presentation.
Go ahead, Mary. Nothing? No.
Is it gone?
I
So
believe
going
Mary,
into
I'm sorry. I believe Mary was muted and couldn't get her.
Okay, that is fine. I will proceed. I apologize about putting Mary on the spot there. So in regards to lessons learned, so if we're looking at, if you go to the next slide.
I've been unmuted by the organizer. Thank you.
Okay, thank you. Sorry, go ahead.
Just so, I'm sorry, not to interrupt you guys, just so you know, we only have about a minute left.
Yes. Yes. What I think the last comment that we'd like to make is that we do have, in light of the APS rule, and actually in advance of the APS rule, the Minnesota legislature has provided resources to expand the reporting system, the online reporting system to all reporters. So we are going to be soon launching a project to expand that for an intuitive reporting system for the entire public to use that's accessible.
Awesome.
And so the last couple slides that we have in the presentation is just some highlighting some things to consider in regards to when making your online report, who your audience is, public awareness marketing, if you allow the reporter to have copies of the report, and then, you know, handling some of those non-maltreatment referrals. If they're not coming here to make a report, making sure that they have the correct referrals to where they can actually get the assistance that they need.
The last slide in the presentation has our email, and so I know we're out of time. So if you have questions that we haven't been able to answer, or you think of things when we're done, please feel free to email our general email box here, and we will get a response.
Okay, we unfortunately do not have time for questions, so I will say this is the contact information for the APS TARC. I want to again thank our presenters for today, Mary, Margie, Donae, and Andy. And again, we will send out a notice once this is available. The recording is available on the YouTube channel. And I wish you all a very happy rest of your day. Thank you all.
And And it sounds like you can reach out to us by email if you have any questions.
Yes, please. Thank you.
Thanks, everybody. Have a great afternoon.